I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Hello, listeners. Dr. Fiona Lovely here. Thanks for listening to the Not Your Mother's Menopause podcast. I've got a great episode for you today. I just finished having a conversation with Katie Beecher, who is a medical and emotional intuitive and a licensed professional counselor. And she has quite the interesting story to share. And she's also an award-winning pole dancer at the age of 60. So make sure you go and check her out on Instagram. She's got such a great, inspiring story herself. But then we got to dig into some really interesting medical things. Let's say I ask what her guides have to say about perimenopause and menopause. I ask what the guides are saying about dementia and Alzheimer's and what that experience is like. But then we really dug into something that is personal to Katie, and I can tell you I'm seeing this more and more in clinic, is Ehlers-Danlos Syndrome, or EDS. This is connected to a cluster of symptoms that look like hyperflexibility, but in pain, that look like neurodivergence, that look like hypersensitivity, that look like people-pleasing behaviors. Maybe you've had the misdiagnosis of fibromyalgia when in fact you're underdiagnosed EDS. So we had a big conversation about this, and I think this was such timely information. I know I learned a bunch. I took a pile of notes while Katie was talking, and I encourage you to do the same. But even if you don't experience EDS, etc., Katie shares her inspiring story of being raised in a traumatic environment, having had an awakening at a very young age, having had experienced an eating disorder, which apparently is also connected to EDS. Who knew? I learned all kinds of things. And then she was connected with a counselor who was trained in the Jungian tradition and was very accepting of what was going on with her. And that was an important part of her journey. So let me introduce my guest today. Katie Beecher is a medical and emotional intuitive and licensed professional counselor featured by numerous media outlets, including Poosh, Miranda Kerr's, or Cora Organics, and Goop, who called her eerily accurate. As part of her acclaimed readings, she creates a detailed multi-page report and intuitive soul painting, knowing only a person's name and age. She has over 30 years of experience helping people all over the world transform their lives and their health. Katie has a BS in biology and psychology, an MS in counseling, and certification in special education. She's also been a professional watercolor artist. Tune into this episode, this conversation, because I tell you, I promise you, you're going to learn something that you didn't know before. So without further ado, here's my conversation with Katie Beecher, medical intuitive. Let's talk about something incredibly important, your heart health. You probably already know the stark statistic. Heart disease is the number one cause of death in the United States. Now, it's widely understood that men develop heart disease earlier in life than women. But what you might not know is that this difference starts to change as women age. By the age of 65, women begin to develop heart disease at the same rate as men. Why does this happen? Well, the sources tell us that declining estrogen levels play a significant role. Estrogen has a profound impact on our cardiovascular system. It actively improves our cholesterol levels, keeps inflammation down, increases crucial blood flow around the body, and even helps to reduce damaging free radicals. Think of estrogen as a vital protector for your heart. It's important for our heart health, too, to take minerals. Certain minerals, such as magnesium and boron, are highlighted as being essential nutrients that our hearts and bodies need to function at their peak performance. When your mineral levels drop, it can lead to a decline in both your estrogen levels and your overall heart health. This is why I'm so enthusiastic about my partnership with Beam Minerals. They have formulated a fantastic way to make getting your daily electrolytes and essential minerals absolutely effortless. Forget about cumbersome pills or messy powders. Beam Minerals offers a simple solution. Just a small shot each day provides your body with the natural, plant-based support it needs. Ready to take proactive steps for your heart health and overall well-being? Head on over to beamminerals.com and don't forget to use my special code LOVELY to receive a fantastic 20% off your first order of Beam Minerals. That's LOVELY. Thanks, Beam. This is the Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely, and I'm joined today by Katie Beecher, who is a medical and emotional intuitive. Oh, I'm so excited to talk to you about that. Licensed professional counselor and author. Katie, welcome to the show.
Thank you so much. I'm so excited to be here. I've already had a blast with you in our pre-taping. So
yes, exactly. It's always so fun to meet people, and I want you to know that you're just so welcome here, and whatever you want to talk about, we can discuss today. There are no rules really here. And I know in the lead up to the show, I had a couple of people ask me who I was interviewing coming up. And I said, I am so excited. I have a medical intuitive coming up. And of course, they say all the things at that point, right? So now, I'm sure you have heard it all, but please tell us, what does it mean to be a medical intuitive?
what the hell do you do?
Yes.
Yes. So I work very differently from other people in this space, but the general gist, and then I'll tell you what I do, is to look into people's lives and their energies and their bodies and investigate what are the root causes for what's going wrong. What are the strengths? What are things in your life that have impacted you and influence the way that you think or do things or your health? And with just a name and age, I create a 4-page report and an intuitive soul painting. And they're all very in-depth. It's physical, emotional, spiritual, tons and tons and tons of information and detail, things I've never told anyone before. And, it includes like the physical and emotional symptoms I pick up, but also I teach people how to connect to their intuition. And I bring up childhood things or relationships or boundaries or career or literally anything, because everything we do and have experienced impacts us in our lives now. Mm-hmm. So people will come to me for a variety of reasons, sometimes because they have symptoms and they don't know what it's about. I legally cannot diagnose, but I can identify things and say, hey, take a look at this or whatever. And people I refer to that I trust. So there's that. But also some people just want to know, like, why am I having these issues in my relationship? Or I keep picking the wrong people, or I'm having problems with my in-laws, or, I want to connect to my body, or like, what's the deeper stuff going on? I know physically what's there, but is there any emotional and spiritual stuff that this is linked to too? And the painting part is very fun because I'm careful about what I put in reports. I don't know who's going to look at them. And sometimes seeing the words sexual abuse, for example, when you've never talked to anyone about it, is kind of traumatic.
Yes,
so,
of course.
Right. So in the paintings, it's fun because, for instance, if I pick up trauma in the second chakra area, the, sexual organs, hips and stuff, they show it to me as like red around the area or different shapes or different things. And people will look at that and be like, oh, I know what that is. And this happened. So it's a gentler way of, revealing information and talking. And then, so I send the report and painting before we meet. Then when people get it, they're always like, oh my God, this is freaky. And I'm like, thank you. I don't ever take that for granted. But we discussed it. I get a lot more information from my guides, and I give people steps to then take moving forward about, ways that they can, grow and improve their health and wellness and all kinds of things. Fertility, I work with a lot of menopausal and perimenopausal women, which I love because a lot of them are just learning how to use their voice, for example, and learn who they are and their authenticity.
Yes, learning how to use our voice. Isn't that a thing? That's a beautiful way to say it. And it's so true, especially for the current generation going through menopause or the perimenopause transition. We really are learning how much we've been ignored by medicine, but also uh, I know how we can get to using our voice. So let me take it back to this for a second. Was this a sort of situation in my mind? I go, you were a counselor, and then you just started to get these intuitive nuggets come in, which now was your guide speaking to you about the people that you were working with, or was this something you trained to do? How did you end up becoming a medical intuitive?
So how did you end up to be this freaky person?
No, freaky and fabulous.
Oh, thank you. It started as long as I can back as I can remember. I remember like being 3 and watching my parents get into some stupid argument about eggs and looking up at them and hearing this voice, and it said, "They are not equipped to raise you. You are more spiritually involved. You are on your own." And I was like, that makes sense. And just knowing what people were thinking and saying, and as a child looking at the things that family members would do to, like, talk behind each other's back or anything like that, and just being like, this is not right. Like, I just knew that something was not okay and that I needed to do things differently, and that this way of life was not congruent to who I was and who I wanted to be. And because of bullying, because I went through puberty early and girls suck, and dysfunctional family, I developed a really severe eating disorder. And when I was 16, it was really severe. Like, I was suicidal. I was like, this is not okay. Throwing up 3 times a day, hating myself, the whole thing. For whatever reason, I think it was divine intervention. And I tell this story in my book, so I'm sorry for people who've already heard it, but I called our pediatrician when I got home one day from school. And I had not told my parents, I had not told anyone. And I called and I said, this is what I'm doing and I need some help. And it was 1983, so no one was really talking about that. It was okay, it's fine, you'll be a comic. No, I'm not. Okay. Fortunately, he connected me with a Jungian psychologist. And people who are Jungian are very accepting and encouraging of connecting with intuition and of symbolism, of looking at what's the meaning behind the physical symptoms and emotional symptoms, and even communication with the other side and psychicness and all the things. So for the first time in my life, I had someone to talk to about the weird experiences I was having, and talking to dead people. And right now, like, yes. Seriously, yeah, right. Yeah. And I was being encouraged to talk to my intuition and to listen to it and to separate from my dysfunctional family and to think differently and to talk to my eating disorder as my friend, because it needed to be there to help me change. It was so essential. So it was a totally different way of looking at life. And I was really motivated. And I've been recovered for 35 years, hardest thing I ever did, but that's okay. And became a counselor. And even in my sessions, I just would let my intuition speak to me, my guides, whatever, it's all one and the same. Let them speak to me. And I just found that they were always on and trusted them and didn't really know what to do with the mediumship, weird stuff. But it just kept creeping in to sessions, and I would accidentally channel people's dead relatives in sessions and
Wow.
questions from them.
Wow. Wow.
Um,
That's awesome.
I helped somebody get pregnant by channeling her grandmother. That was pretty darn cool.
Wow.
Um, and so I was like, okay, I can't, pretend this isn't happening anymore. And then I got involved with a spiritualist church, which is a place you can go and actually get medium readings if you want, and really, really neat, weird stuff. So yeah, it just sort of evolved. My mom got very sick and ended up being her caretaker, and just all of kind of a lot of really bad things that happened sort of led me to this path. And I found out that I could do all sorts of interesting and strange and wacky things.
Oh, strange and amazing. You know, we all have this intuition, but it's literally taught out of us by our culture. So you relearned it in a way, or you never lost it and you got the right people at the right time to counsel you to reinforce it.
It was definitely lost for a while. In my house, it wasn't okay to talk about the truth or expose things or be a strong female or anything like that.
I
So
see.
it got pushed down. And that's why the eating disorder had to happen, because I had to be sick and uncomfortable and in enough pain to do something to change that.
Yeah,
And,
wow.
eating disorders have tons of female energy connected to them, no matter whether you're a male or a female who has the eating disorder. Food and nurturing, and it's really pretty amazing. So, and I've been told that I am one of the least non-woo-woo people that some people have met, because we all have intuition, all of us, and it's not evil, and it's not against the Bible, and it's not all these things that sometimes people say. And we all have medical intuition. Like if you have a stomach ache, you have to figure out, what is this about? Do I need to eat crackers? Do I need to go to the doctor? Do I need to lay down? What was this from? Did I eat something? So you're doing that medical detective work. And
Yes.
even with your kids, right?
Sure. Women are great at that.
Oh my God. So it's there. What I do is to the nth degree, but we all have it. And I really like to normalize it instead of making it seem like you have to be special or have special gifts, or because you don't,
Mhm.
it's always there for us.
Oh, that's so interesting. Well, and having worked with perimenopausal and menopausal women for 20 years in my practice, my intuition and my instincts serve me so well. And, for me, it's just kind of an acceptable thing because I do hands-on work. And so I share what I hear. And I've had patients bring in their spirit family with them. And I've seen things, I've heard things, I've seen the lights flicker. I mean, there's been all kinds of things that have happened that I never anticipated would happen. But I think when you're open to it, it just kind of shows up, right?
Exactly. Exactly. I love it.
Well, so like who's around us, Katie? When we're talking about as we move through the world, we see in 3D, but there's so much more that we don't see. And this isn't a woo thing, this is science. So who's around us? Who spends time with us as we move through our days?
When I first started communicating with intuition, I just talked to a generic God. Um, Saying the Lord's Prayer, connecting to that love, was always what helped me if I was picking up like evil or negative energy. So that was a natural place to go. The more I did it, the more I learned that I was also talking to spiritual guides. And so what I see when I look at my guide family, as I call them,
Right.
is me, a circular table. The first row is like my grandparents and the people that I was told along the way are there. So for me, it's an elderly Native American chief type of person. And then there's some younger females, and one of them is like Inca or something, something of that persuasion. Never seen their faces, just their energy. And then just rows and rows and rows of other spirits and other people. And I really do think that we all have that. Just, I don't know, angels, it's, spirits that aren't coming back anymore, who are now guides, who are So I don't think that the label is as important as feeling that energy. And the way that I like to think about it is that it's a loving force connected to unconditional love and acceptance we all have access to. It's like having a best friend with you all the time, somebody that knows everything about you and loves you anyway, a protector, a place where if you get what you need from that, what other people are doing and saying and thinking is far less important. So it helps you ground, it helps you set boundaries. And even if you're by yourself, you're never alone.
I
So
love that.
that's the way that I like to think about it. And that has always served me.
Oh, I love that. So we have this the myth of separation, and that we are individuals, but the truth is we're just all parts of the whole, and no one should ever feel alone. We are literally walking with others. We may just not see them in the same form that you and I are looking at each other in. Are the animals there?
Oh gosh, yes. Yes.
More.
I love doing pet readings. It's so fun. During my readings, sometimes in a painting, let's say an animal will show up. I'll make their pets or something like that. We were talking about your cat before this started. They are always dogs, cats, whatever, always attracted to this, and walk in front of the screens. They are always there for you. They are your guides also. The cool thing about pet readings is it's kind of like a 2-for-1 for the human, because animals, what I've learned is they're there to serve us and take care of us. We think it's the other way around, but it's not. And they pick
Wow.
up, right? They pick up on our illnesses, our emotions. They know what's going on with us. They will readily take on our pain for us so we don't have to feel it. And they not only tell me things about them and their health and their backgrounds, but they also tell me things about their humans that, maybe somebody will spend the time or money or energy to get a pet reading, but not do it for themselves because their animal is more important to them. But their animal's like, yeah, no, dude, we're talking about you. You like it or not, right?
Yeah.
And I'm here for you, and we're going to help you just like you're helping me. So the intertwining of our lives with our pets, especially horses, for some reason, horses are like these supernatural. It's just, I know
Wow.
Jack about horses, and they're the most fun thing to do a reading on because they're so human. I mean, all animals are, but yeah, it's really a different level. And I've always been close to animals from the time I was really, really, really young. So it's
Interesting.
yeah.
You're safe for them. You're a beautiful energy for them. They're probably drawn to you. I remember years ago when I was learning how to chant with my meditations, the animals would just flock into the room. The dog and the cats would flock into the room. I'm laying on my yoga mat, being surrounded by them. And I realized it didn't take me very long. I thought, what the heck's going on here? It didn't take me very long before I figured they were attracted to the vibration, the frequency of that sound.
Love it. Yeah,
They know so much more than just because they can't speak to us. We think they don't, but man, they are wise. They are wise.
absolutely. Yeah.
Okay, so we are surrounded with energies. These energies can influence us, whether positively or negatively. And the question I have for you is, how do we go about protecting ourselves from those energies, keeping our own energies safe?
That's a great question, and I get it a lot. And I find that people don't realize how empowered they are. So when I was young, I picked up a lot of real scary stuff, and like really scary. And thankfully, I had a therapist at the time who
Yeah.
was like, okay, the reason that you cannot go to a horror movie, or at that time I was 10, The Exorcist came out, the reason that you're afraid of it is because you understand that good and evil exist. And I was like,
Okay.
okay, that makes sense. And she also told me something that has stuck with me and just come to bear all so many times, that if you are a loving, caring person and try to, be a decent human, are not under the influence of drugs or alcohol, are not actively seeking out evil things. If you're present, then you are naturally protected from negativity and evil. And if you feel it around, it's going to be there. It's going to try and get us through fear, or through pain or other things sometimes. If you feel it, all you need to do is be like, I'm sorry, you need to go. Love is more powerful. You're not going to win. And that can be really confusing sometimes, especially for empaths. Because, right, you feel like that energy is so powerful and it's taking over. Please remember, there's a big difference between taking over and being able to sense it. So, are we influenced by negative people who are energy suckers? Absolutely. But does that take over our energy? No. We still have control and we have our own energy. And that's where you and your intuition have the power to say, I need to get away from this person. I need to spend less time with them. I need to set boundaries. So it's really about listening to your authentic self and your loving intuition and giving yourself the power to decide who you want to spend time with. That's the best way to do it.
So, am I seeing a pattern of empaths who are also hypermobile, who are also neurodivergent, who are also people pleasing, who are also misunderstood by medicine? Or am I out to lunch? Am I making this up in my head?
Oh, no, you are not. You are not.
Okay. Tell us more.
Yes. So hypermobility, EDS stuff is very near and dear to my heart because I have it and one of my daughters also has it. I pick it up all the time during readings. It is, there's, as you know, there are 13 subtypes. Yep. A lot of the subtypes are rare. The most common one is not rare at all. It's all around us. And it just has been notoriously difficult to detect. I think that the way that they diagnose it is really outdated and needs to be changed.
Agreed.
Especially the stiffer you get, the less flexible you are. The older you get, the less flexible, the less you move. If you have pain, the less flexible. So just measuring it by those flexibility standards is not the
good
best,
enough.
right?
Yep.
But yes, there is a ton of correlation. And I found this personally and in looking up studies and things between being empathic, being highly sensitive, being neurodivergent, eating disorders.
Okay, same. Yeah.
All kinds of things, right? And hypermobility and EDS. And part of it is because when you have EDS, you don't have great proprioception.
Okay.
Really know where your body is in space. You feel very floaty. There's body dysmorphia because you don't really connect to your body. You feel like your body is foreign because it does all these weird things that you don't make it do. I do pole dancing like as a sport, like aggressively, 8 or 9 hours a week. And I can be on the pole and not hurt myself. And I can like walk on a mat and, hurt my ankle because I walked on a mat that I had to step up on or get out of bed. And I'm like, why did my back hurt? Because I got out of bed. Like great, stuff you feel like things are out of control.
Yeah, I'd say.
Right. And then there is, so hypermobility EDS, it's a inflammation of the connective tissue. You're walking around with inflammation all the time. You're hypersensitive to things. So all like little, like not only just mold or allergens, but smells or everything impacts you. So you're kind of constantly putting up this wall between you and the rest of the world as protection.
Wow.
And that also, there's connective tissue in your brain, in your gut, where you make all these neurochemicals. And to me, like the more you know about this, the more it makes sense. And connecting it to the title of your podcast, it screws up our hormones.
Yes.
I had hormone abnormalities from really, really early on, I was on hormone replacement at the age of 29. I
Wow.
needed to
Okay.
take estrogen
Okay.
because a year and a half after I had my older kid, I had what they thought was a nervous breakdown. Thank God I had a really good gynecologist who was like, that's not right. Let's test your hormones. And it was postpartum and it was
Yes.
estrogen. So wacky hormones, right? All
Okay.
of these things that influence every part of our life. Um, and then the hypermobility makes you susceptible to other things too, because it, influences your immune system and all the stuff. So it's really mind blowing to me. And it's also mind blowing that even if you have the same subtype as someone else, my daughter and I have the same subtype, we have very different symptoms. We have similar symptoms, but we have very different symptoms too. So there's no one way, that someone is going to act or feel or
Okay.
or recover or be treated,
Okay. So,
complicated.
Katie, this is not being well managed by allopathic medicine at all. What, if we can tap into the intuitive part of you, not that they're separate from what you've said, but what do we need? What needs to come forward? How does this better need to be addressed? Because I see it all the time. I see it in my family now, even though nobody noticed it before, and now all of a sudden there's a bunch of us. What's going on there? Please tell us, who do we need first of all? What needs to come in and intervene?
Well, what I've done, because it's been so frustrating, and I pick it up all the time in my
Hmm.
readings, and people would always say, where do I go? What do I do?
Hmm.
My daughter, being the amazing, assertive 20, she was 25 at the time, got herself diagnosed. She had to go to a few different doctors. The first one was like, oh, no, you don't have this. It's rare. She got herself diagnosed and went back to that doctor and was like, hello. Anyway,
Yeah.
so being assertive, fighting for yourself, trusting your intuition about how you feel that this isn't right, you know. Um, I didn't get diagnosed until a few years ago, and it was my daughter who like pushed me. I live near Mayo, so I went to the clinic. And um, so, fun fact that irritates the living shit out of me is that getting labeled
Mhm.
as fibromyalgia.
I literally just wrote this down and said, is this fibromyalgia misunderstood? Like, is EDS the evolved version of what we called fibromyalgia for a lot of years?
So fibromyalgia just literally pisses me off because by definition, if you know you have something else that is causing your symptoms, you don't have freaking fibromyalgia. And fibromyalgia was coined in the late 60s by a man, and that you can look this up. And part of what he said was it's for women who ask for too many tests and ask too many questions. That is a real thing.
Oh,
And so it's
God,
awesome.
that makes me mad. Okay,
Um,
yes.
when I went to, and I will use the word Mayo, pisses me off. You fill out these questionnaires. You don't get to explain anything on the questionnaires. You just have to answer questions. Do you have chronic pain? Well, sometimes. The reason I have chronic pain is because I have dislocated both of my shoulders and I'm on a pole all the time, and I'm 60 years old, which is not an excuse for pain. And I have EDS. So that's why I have the pain. They actually labeled me, knowing I had EDS, labeled me with fibromyalgia.
Come
It
on.
took me 6 months to get that removed because I had to fight with the doctors. And even though all my other doctors, my PTs were like, you don't have that. And I'm like, I know. It took me forever to
Wow.
get taken off. They actually told me, well, it's because of central nervous system disorder or sensitivity. Well, where'd that come from then?
Yes,
Like,
exactly.
okay, that
Yeah.
didn't happen out of thin air.
Yeah.
I later found out that Mayo was doing a study that I didn't even know I was part of, trying to link fibromyalgia and EDS. So I mean,
Oh, okay.
great. They'll probably throw me out of their practice now, but
Nah, it won't.
so
They're not listening. They're
you know,
not listening. If they
so
were, they wouldn't be doing stuff like that.
no kidding. So I really feel like from EDS, Lyme, weird autoimmune stuff, a lot of things, maybe cortisol stuff, thyroid stuff, all of those things that are really wickedly hard to get
Yeah.
um, treated seriously.
Mold toxicity is
Oh,
another
dear
one.
God.
Yeah.
Big time. I had
Yeah.
that twice. Yep.
Yeah.
So I think that that's what is getting labeled as fibromyalgia because it's easier and it sells really expensive drugs.
Oh God. Well, the drugs themselves are new-ish. For a lot of years, there was nothing that was offered to mostly women
Mm-hmm.
and that were experiencing fibromyalgia. That's
Mm-hmm.
a really fascinating thing. Okay, so as you were talking, I thought to myself, I wonder if what we now call EDS was the same presentation that we used to call fibromyalgia is what went through my head.
Yeah,
It's a bit of a junk term. It was kind
it
of
is.
it's useless, really. It's not helpful. It's not helpful at all. And I can tell you I got next to no training on it in my own professional education. But yeah, wow. Okay, that one's going to be rattling around inside my brain for a while there, Katie. Let me tell
Yeah, I
you.
just did a post on that about how it can be actually unhelpful to get a fibromyalgia diagnosis because it stops you and your practitioners from looking any further. And then it's just,
Yeah.
oh, you just have this, and now you have to band-aid symptoms. Well,
Yes.
how is that helpful?
No, it's not. Um, okay, so this cluster of symptoms that show up, whatever we're going to call it, we'll just say EDS, which stands for, please say the words for me.
Ehlers-Danlos syndrome.
Ehlers. Okay, I always get the first word a little weird. Okay, and so if you're Googling EDS and it comes up as erectile dysfunction syndrome, it's not that one, it's the other one. Okay, well, and there's a lot of people like this. And because I work in somatic therapy as a chiropractor, this is something that comes up all the time and is terribly misunderstood, not just by me, but the physiotherapist, the massage therapist, the acupuncturist, any of us in the clinic. We have had zero training on any of this. But you can see the cluster of things that comes in. It's the concussion patient that also has a chronic shoulder thing that doesn't respond to the typical treatment. For me, whenever I see someone that's just not responding to a typical treatment, I'm already starting to think, okay, we need to back away from what we typically do and take a different approach to this. And I think that's
Yes,
important to think about.
love to talk about that.
Yes, please hit
Okay,
me.
so we are all different. And for me personally, for my daughter, um, if I did not move my body, I would be in far more pain. So for me, movement is essential.
Yep.
I've always been active. I used to do gymnastics, la la la. The pole stuff I do is extensive for anybody, any age. So it's a little extreme. But what I'd like to tell people is do what you like, move the way you enjoy. If it's uncomfortable, don't stop. If it's painful, yes, stop and
Yep.
figure it out. Do less or figure things out. But if you do not move, you will get stiffer. You will be in more pain. You will not be able to release stress. You will not be
Mm.
able to release anxiety and depression, which adds to the physical symptoms. So
Yes.
there's that. Um, Symbolically, one of the ways to look at hypermobility is that you may be too flexible. So you may be doing too much for others. You might be bending over too much, not doing enough for yourself, not taking
Oof.
care of yourself. Conversely, as people with EDS know, there are very stiff parts of your body too. My back, I'm lucky it bends at all. But I can do a split three ways. Okay, so right,
Just doesn't make sense, does it?
it makes no sense.
It makes
Um,
sense for you, for your body.
yes, and it's annoying. But so the stiffness part, maybe you are too rigid in some of your beliefs. Maybe you try to control. Maybe control is like a survival mechanism for you. So when people try to give you input, you don't respond, you can't let go, you can't connect to spirit because you have to feel like you're in control and fear mode.
Mm.
It's also, if you think about it from a back perspective, it's you don't feel supported, right? Because you don't feel like your body supports you. Your ligaments are wonky, your tendons are wonky, It makes it so you can't maybe control your muscles, or one side of your body is very different from the other side. So you physically can't support yourself the way you'd like. So have you and are you getting that support from yourself and others in your life, right? So all of those things have been really important to me. One of the best things about being evaluated is that I got to go to physical therapists who were EDS experts.
Oh, that's huge.
Usually, when you go to a PT, insurance will only pay for one body part. We're connected, we're not a body part. So they were able to look at my entire body and say, okay, what's loose? What's tight? What's weak? What's really strong? By keeping my body strengthened, especially in the areas where I'm more flexible, like a hip flexor is a good thing. The stronger your muscles are, the more that they will be able to support your bones, and the less stretched out your tendons and ligaments will need to be, because you have that strength. So you'll have more energy. I had osteopenia for 10 years. No one told me why. When I started to do pull, I reversed it. Like
I bet you did.
Right? Osteopenia is a huge risk for people
It
with
is.
EDS and eating disorders, all the things. So it's really about being strong, moving. Also, when you're physically strong, you're emotionally strong. I don't need to ask someone to help me lift my 40-pound bag of mulch. Thank you.
No, that's right.
I can take care of myself. And so you feel less vulnerable and less threatened in the world. There's so many things, but I want to stress that I understand that there's people who are in an incredible amount of pain every day, and that they may not feel like they can move, or they only feel like they can do a little bit, or it's really overwhelming, so do what you can, but don't be afraid to push it a little and do some different things, because they might be helpful.
Okay. As a doctor, I believe that one of the best aging breakthroughs of the last decade is qualia senolytic. And here's why. As we age, our bodies tend to accumulate senescent cells. Senescent cells are also known as zombie cells because they linger in your body long after their useful function, wasting your energy and nutrition, which can contribute to less energy, slower workout recovery, joint discomfort, and basically feeling old. Qualia senolytic is a clinically tested formula with 9 vegan, non-GMO, gluten-free, plant-derived compounds that help your body naturally eliminate senescent cells, helping you feel years younger in just months. And the best part? You only take Qualia senolytic just 2 days a month. It's an easy thing you can do to feel years younger, and it can literally transform how well you age. Go to qualialife.com/lovely to try Qualia senolytic. It's backed by a 100-day money-back guarantee, and use promo code LOVELY, all caps, to get 15% off. As always, I'll leave the links in the show notes. That's Qualia senolytic at qualialife.com/lovely with the code LOVELY to age amazingly well. I understand, I have not read this article myself, but I understand that Vanity Fair recently published an article on Billie Eilish, and she has EDS. Yes, and she has apparently physical therapy every day just to keep her out of pain. I had heard that. So, like Lyme was several years ago, once the celebrities start talking about what they're experiencing, then the rest of us don't feel so marginalized by it. Because medicine's very good at gaslighting us and telling us it's something else and whatever. Okay, here's the question that's coming to me, and let's see if I can put this in a good way. I do believe that the great trauma unveiling that we've had in the last, I don't know, kind of feels like it started with the Me Too movement, is somehow playing into all of this. And we can talk about it as the psychology of humanity versus how these symptoms are coming up. Maybe they're connected, maybe they're not, but I'd sure like to hear your thoughts on that.
Yeah, it is really fascinating, um, because if you think about how an average hypermobility EDS person feels, you don't feel very empowered. And your body's kind of doing its own thing out of control. You may need others for daily care or for help or things like that, right? And so the Me Too thing is, and I don't want me to call it a thing because it's huge and important, was saying we're not going to let this patriarchal, misogynistic society keep
Tell
us
us.
quiet, keep us
Yes.
down,
Yes.
keep us weak. We're going to talk about these powerful men, who got away with treating people horribly for such a long time. And they used power and control and fear and all these things to keep us down. And I I don't think it's an accident that these, and EDS is men and women. Interestingly, it does affect more women, at least it seems to that way, right? But
And the more severe types tend to be men, interestingly
yeah,
enough. Yeah. With the
yeah,
connective tissues. But anyways, yeah, please go on.
yeah, no, it's all true. So by being like, you know what, we don't feel good and it's not okay.
Mm-hmm.
And I don't care if you don't know what it is. We're going to keep talking and keep fighting until you do. We're going to keep advocating for ourselves. And even eating disorders are linked to sexual abuse and sexual assault. So, there's all these connections, and also so many awesome EDS people are neurodivergent and they're creative and they think out of the box and they're not going to just succumb to the way things have always been done. You know,
Thank
um,
God.
thank God is right, right? Oh my God. So until you talked about it, I didn't really put two and two together, but I love that you did, because when women are uncomfortable or in pain, we're really not very quiet, and we shouldn't be. And we were quiet for too many centuries.
Yes. Yes.
But now it's like, no, something is wrong. And you're not paying attention, and you can't just label us with some psychiatric.
Yeah.
Fibromyalgia is very psychiatric,
Fibromyalgia. Yep. Yep.
right?
Yep.
Or tell us it's all in our heads, or that we're making it up, um, or that you're making up the fact that you touched me. You did touch me, or you did treat me like crap, or you did treat me differently because I was a woman, or whatever.
Yep.
So I do think it's like our bodies being like having to be in pain to get our attention to then speak out and advocate for ourselves.
Wow. Yeah, and I don't I actually wrote that question down. I had two questions written down for you after I did my research earlier this week. So that one wasn't I didn't plan it. It just apparently I don't
Intuition.
know. Yes, the great trauma unveiling. Who's called that? But like now we're talking about it. We're informed about it. We have informed practitioners about it and practices with it. And so it needs to get out so that we're no longer keeping these things in the dark, in the shame. And I think the menopause explosion of information, isn't it interesting that it goes along with all of this, which also seems to correlate with the COVID years? I can only imagine what the astrologers have to say about all of this. More importantly, where can I find that information?
Uh,
Right?
it's like,
Please.
even, I said I was 60, right? A few years ago, went to
And
my
fabulous. 60
doctor.
and fabulous. And by the way, Katie has mentioned her pole dancing. Please go on her Instagram, which is Katie Beecher dash medical, underscore medical underscore intuitive. Please go and see this gorgeous woman dancing. You go, she is 60. What? Oh my God. That
Thank
is,
you.
yes, it's really hard to do. I'm so impressed.
It is. Thank you. I've won 2 national championships in my category. So,
Amazing.
woohoo.
Amazing.
Terrifying, but also cool. Um,
Amazing.
so went to, my doctor, whatever, talking about hormones. And she's like, we should probably talk about getting you off of your hormone replacement. And I looked at her and I said, you're going to take it out of my cold, dead hands.
Yes.
And she started laughing. And I said, oh, you think I'm kidding? If I don't get it from you, I don't care where I have to get it from. I'm going to get it because this is about quality of life. This is about strength and not wanting my bones to disappear and having a sex drive. Oh my God. They give men Cialis and testosterone until they're like 100, right?
Yep.
But if you're a woman, because you don't get a period or don't have kids anymore, you don't deserve a quality of life.
Where do they think all those hard penises are going to go? We just finished the equation on that one.
Why don't you live with near me and we can hang out? I don't understand. Okay. Yeah, exactly. Exactly. Right. And then there's this fear. I still talk to women all the time. I'm afraid to take estrogen. I'm afraid I'll get cancer. Well, there are things, there are risk factors, there's stuff, right? Be informed. But like that's really been so overblown. And your quality of life and your ability to fight off cancer and your immune system and all those things will be so much better if you feel better and have energy.
Yes, absolutely. Yes, you'll pry it out of my cold dead hands, or your cold hands is what you said, I think.
I did.
That's exactly what I would say to my hormone prescriber too. Don't you dare.
I'm stronger than you. Don't try it.
Exactly. I've seen the evidence. She is indeed. Okay, I want to ask about what I don't know if I should say it as the guides or what your intuition is saying about.
Same thing.
Okay, very good. So I can use either language. What's happening when we experience mild cognitive impairment, pre-dementia, Alzheimer's? Can you talk about that? Because that is a women's issue.
It is. It so is. Often related to hormones, too. As you know, I don't tell you this. This is your podcast. Right. Yes. So what they're saying, my guide people are saying, is it's a disconnect. It's a way of tuning out and being even less in your body than usual. It's a way of, if you already don't feel empowered, if you don't feel like you have a voice, if you don't have boundaries, if there are things happening in your body that you don't feel you can control, if you've had trauma, that's all really hard stuff. And if you don't have support, it's even harder. So what I'm hearing is by disconnecting even more from your cognitive faculties, you're sort of like saying, this is too much. Life here is too much. My pain is too much. How I'm feeling, this is too much. And I have to go somewhere. And personal story in my book, but my mom, as a drug reaction, I'll put it that way, had a stroke and she got GBS. And she was paralyzed for 10 years until she finally died from this lovely medication. I firmly believe that if she had left my horrific father, when they got married, basically 45 years before, or had left any of the times she said, I'm getting out of here, she would not have needed to have the stroke. She asked me to divorce him for her because she didn't have the strength. She wasn't able to do it before. She literally, it was the only way to get him out of her life. And she still couldn't permanently do it. It was the tie was such a sick thing, but that was her only way. And it's an extreme case, but it's true. Like I talked to her about it. She said she agreed with me, that this was the only way. So mild forms of it as we get started, it might feel really good to start going to that other side and not be here, not be in this body, not be in this present world. And that's really so sad to me.
Yeah. I remember watching a show with the medium. I can't remember which show it was, but it was the one where the medium goes around with the celebrities. And I can't remember the name of the medium herself. It was a woman, I can tell you that. But she was talking to a celebrity and she said, your grandmother has passed. And the celebrity said, not yet. And she said, she has dementia or Alzheimer's. And the celebrity said, yes, we think so. And what the medium said was, when someone is still here physically, but they're experiencing dementia or Alzheimer's, they feel not, they feel almost like they're not here anymore. Like to her, that's what the energy of this spirit felt like, is that they were, the spirit was gone, but the
Yes.
physical body was still there. What do you say about that?
Yeah, that's exactly. You feel, and there are people who don't have dementia who live between two worlds who feel more comfortable over there, right? But it's the actual physical brain cell, body cell way of really disconnecting from this body and going to wherever we feel comfortable, where we feel safe, the other side. um, I've picked that up a lot too, because I do, mediums, other people from other places come in during my readings.
Mhm.
And yeah, that's how they come through to me too, is that they're living between two worlds, and a part of them has gone to the other side.
Yeah, wow. Fascinating. Okay, what is the what does spirit say about menopause and perimenopause? What do we need to know?
We need to know that women need to know more about it. um,
Yes.
because just those two things can get diagnosed as fibromyalgia.
Oh, I know that.
Right, don't tell
Yep.
you again,
Yep.
this is a podcast. Right, so familiarize yourself with those things. Each case is different. Get to know you and what possible symptoms can be there. Don't just go by age, because you can go
Oh,
through
yeah.
these really early.
Mhm.
And even if somebody says to you, oh, you're too early for that, well, you may not be, right? So be open to you, especially other conditions, like an adrenal issue can tank all of your hormones, for example, right? I mean, that's kind of like going through menopause, but you can be 20. Um, I think it's really important to know, to advocate for yourself, to get some out of the box testing, because regular blood tests for hormones, it's a moment in time. um they they don't look at like even a 24-hour cycle, or they don't look at how you're processing those hormones. And if something's in your bloodstream, you may not be absorbing it, so your body may not be utilizing it, right?
Mhm.
Like the B vitamins and things. And also, just because you're in a normal range doesn't mean that's optimal for you. Like somebody in menopause who's not making hormones, your norm would be like zero. Okay. So
Yeah.
it's your normal, but you feel like shit because
Yes.
you need hormones. So
Yes.
don't just let them go by norms. And even with
Mhm.
hormone replacement, I love my hormone replacement. I have an estrogen patch and progesterone cream and testosterone cream. Um, I switched doctors because my traditional medicine doctor said, well, your testosterone is showing up too high in the blood test. And I said, that's outdated. That's totally outdated way of looking at it. I knew that enough. And so I found someone who was like, yeah, let's go by your symptoms. How are you feeling? What do you need? And even for like legally or insurance or whatever, they have to do the test. But she's like, this, you need to go by how you feel.
Yeah.
So to really like pay attention to your body and what you need, and to be open to what might be happening to you as an
Mhm.
individual, and talk to other women.
Yes.
Talk to, like, I learned so much from my women friends,
Mhm.
who are going through these things, and you might find that that's what you're going through is normal, but it's also like treatable, and you can get help for it.
Yeah. 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 Well, I think one of my favorite things to talk about around the discussion of perimenopause is the spiritual transition that we go through at this point in our lives. And, to make it biological, the hormones give us we care how we appear to other people during the regular menstrual cycle and the high fluctuations and all of that. And when all of that sort of flattens out and there's not the oceanic waves of hormones happening, we care more about ourselves and taking care of ourselves and nourishing ourselves in ways that maybe we were never able to access before. And with that comes a certain kind of a rebirth,
It does.
like a menopausal rebirth. Now you got a few years on me, so you know this. You know this. You are already a wise woman. So first of all, tell me your wise woman experience and what does the council have to say about that spiritual transition for women at perimenopause?
Yeah, literally, the older I get, the less I care what other people think or think of
Amen.
me, right? Or it's like I always tell people, you have this concept of being afraid of what people think. Well, who are those people? Do you know
Exactly.
them? Do they
Who
know you?
cares?
Even people in your own family, do they actually know you? Have they ever had a conversation with you? Do they like, so why do you care so much what these people think? And you probably don't. It's just this concept in your head, you know?
Mhm.
And so literally, even so, body image is a great example of this. Body dysmorphia. And like, if you had told me 10 years ago, I started pole 6 years ago. If you had told me 10 years ago that I would be in the equivalent of a bikini on social media or in front of anyone or in a class with anyone or in public in any way, shape, or form,
Yeah.
I've been like, you are insane. And my family actually jokes with me about that. They're like, you wouldn't even put on a one-piece bathing suit before you started. And, coming from eating disorder background. So
Yeah.
now I love pole so much that it's the first thing I've ever done, not related to weight and not related to how much I eat. So that's really freeing.
Yeah.
I weigh more because I have more muscle than
Yeah.
I did when I didn't want to put on a bathing suit.
Yeah.
I care far less what other people think of my body.
Yeah.
I just want to be able to go up and do my tricks and do my thing, so I've totally shifted my own body image. Do I think I'm perfect? No. I mean, I still look in the mirror and I can find the wherever the cellulite is, I can point that out in 2 seconds, but it's less important. And
Yes.
I wouldn't have shown it to anyone before. And so the older I get, the more I'm like, I'm comfortable with me. I have an incredible husband, incredible daughters. And I think the younger generations, especially of women, I've noticed care less also.
Yeah. Isn't
You
that
know,
interesting?
they're
Yeah.
much more open. They're much
Mhm.
more like, screw you if you don't like it. They're much like,
Yeah.
I mean, even like they both they're perform, they do other things, but they were performing. They could get up on a stage and sing in front of 8 million people. And I'd be like, I don't even want to talk in front of,
Yeah.
like, so they just are different beings. And I think that's lovely and amazing.
Mhm.
So maybe I like to think that we are generationally healing,
I like
and
that.
that the older we get and we find our voice and things through menopause, that we're also influencing the generations before us.
Oh, yeah. I love it. And what a beautiful time. I know this is something I've been called to do recently as I'm experiencing this for myself in the very end phases of perimenopause is the more satisfaction I feel with my life. I don't have this push pull of should I or do I need to do this and should I have that? And there's just none of that. It's just like, hey, let's go have a good time and feel good while we're doing it.
And if my
Yes.
daughters were listening to this, they'd be like, Jesus Christ, mom. But sex, like,
Yes.
it's so much more fun now. I mean, I could do all these, like, it's just the two of you. Have fun, do whatever.
Yes.
Like, and I
Yes.
have a sex drive now because I'm back on
On
hormones,
hormones. Yes. And there's like a permission to explore in a different way. Yes.
right?
Absolutely.
Right.
Absolutely.
Sorry, children, if you're
If they're listening. Katie, you know what you've just done is you've given the women hope that are in the muck of it right now. And like I said, that's what I've been called to do a lot on social media lately is to leave little memos to say, I know it sucks right now. I've been through it and I'm here to say it gets much, much better. Like stay with it. Not only is a woman more likely to misdiagnose chronic fatigue and fibromyalgia at the age of 40, but she's also more likely to commit suicide in her 40s than any other time in her life. So we are seriously underdiagnosing and under appreciating the effects of the hormonal egress on our brain and our mood and our physical body. But this is why I want the stories of the wise ones that are ahead of us to come out and say it gets much, much, much better. So thank you for sharing all those taboo things you just did. I love every minute of it.
And also, just because you reach a certain age doesn't mean that you're going to be in pain or that you have arthritis or that you have to be tired. Like that is such a male-oriented, male-created myth. Like find out why. Get to the bottom of it, fight it, do, like learn about yourself and don't just assume that if you're a certain age, you're going to not feel good.
Yep. And if your doctor says to you, this is what happens at your age, get a new doctor. Exactly. She shot us the horns. I'm just saying, for those of you who can't see the video. Oh, you're sassy. It is too bad we're not closer together.
If you ever get down to Florida.
Okay, you betcha. Absolutely. And if you ever come up to Calgary, Alberta, Canada, you come visit me, okay?
Nice.
Stampede's coming up. You never know. Okay, Katie Beecher, where can people find out more about you?
The easiest place is my website. It's katiebeecher.com. I am on all of the social medias and Katie Beecher Medical Intuitive and Katie Beecher Poll. That's my poll account, just to keep track on what I'm doing and not falling and things. But yeah, the easiest place is my website, and you can make an appointment from there. You can ask me questions. You can get my book, which is called Heal from Within. You can. It's on Amazon and all the other places too. But yeah, that's the central place.
Okay, amazing. I love it. Okay, final question I have for all my guests is this. Knowing what you know now, what would you tell your younger self?
Oh, God, to not care so much about what anybody thinks or what you look like, and to get away from your dysfunctional family earlier. Dear God. Yeah, listen, it gets better. I've been suicidal. I was there. I'm so glad I didn't do it. Yeah, things really do get better, and you really do have so much more power than you think you have.
Oh, I love that. Thank you for delivering the goods, spilling the tea, and sharing the wisdom with the show today. Katie Beecher, thank you for coming on the show.
My pleasure. I hope we can do it again sometimes. It's very fun.
I would like that.
Great.
Thanks again. The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.